Hello friends, today we are going to discuss about counseling skills. I am Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit working at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only, not for legal opinion or a clinical opinion. For legal or clinical opinion, please do contact respective professionals for help. In today's video, we are going to discuss about counseling skills. What are those counseling skills you should know, you should learn and practice it for providing optimal care to persons with mental illness. Before I start, I would like to give you certain important tips. First and the foremost is no books, no amount of reading article, watching video will teach you counseling skills unless you do it yourself. That is basically a STD model. That is, see the way the professional do the empathizing skills or counseling skills. Try it yourself in front of a trained professionals and do it yourself. I am clearly mentioning preferably learn this counseling skills under the guidance of a professional counselor. Who should learn this counseling skills? Counseling skills is required in various professions, from health to the corporate. From health, the doctors, nurses, and also various healthcare workers, including ASHA workers. In education sector, teachers, principal, all those people need to learn. From the legal fraternity, advocates who are in touch with the clients who are very distressed because of the litigation, fighting with their own family members, do require counseling. Of course, HR professionals in any corporate or any sector need to know counseling skills. Of course, managers and project leaders, custodial care providers, that is prison, juvenile home, hostels, those people also need to know how to do counseling. Of course, lay counselors, religious leaders, and parents also need to know about the counseling skills. These are the people who are going to benefit by this video. Let's understand what is counseling. American Counseling Association defined the counseling as a professional relationship that empowers the diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. So counseling is not only one-to-one, it can happen in a family situation when all family members are involved, also in a group which are homogeneous in nature. Suppose if you are providing counseling to a diabetic group who are having neuropathy, of course, then since it is a homogeneous group, you can provide counseling in a group situation. So this American Counseling Association's definition is very apt. Now let's understand what is counseling means. Counseling means not providing information or advice or ready-made solution. Counseling means enabling the client or person with mental illness with skills to find his own solution. It is basically empowering with skills to solve his own problem. Here it is similar to the Kurukshetra, where Krishna participated in Kurukshetra by providing guidance to Arjuna. Arjuna fought his battle here. You can consider here the Arjuna as a client and Krishna as a therapist. Krishna did not fight Kurukshetra battle, but guided Arjuna to win. When Arjuna had a lot of conflicts, anxiety, fighting it with his own family members, relatives, and teachers. That is all about counseling. Counseling is providing technique how to fish. Counseling is not giving fish. You have to enable them with the life skills so that they learn to solve their problems. Now understand how many sessions has to be done. You call it as counseling skills. Counseling sessions usually lasts like 1 to 2 sessions per week. Depending upon the crisis, you may have to do 1 or 2 sessions even per day. Like for example, there is a huge crisis, then you may have to do daily. In general, it is 1 to 2 sessions per week. Over a period of time, when the person starts learning skills, you can space the duration of session. Between two sessions, you can increase. Initially, 1 to 2 sessions per week can become 1 to 2 per month. Later, 1 to 2 sessions for 3 months once. So in that way, you can space and slowly you will wean off. Counseling session usually lasts for 10 to 20 sessions. But however, if there are multiple comorbidities, too many stressors ongoing, then they may require counseling session for longer period. Generally, it will end with 10 to 20 sessions, depending upon the individual problems, his learning capability, and his motivation to learn skills. All this depends upon the number of counseling sessions. Now we are entering into the what are the counseling skills which a counselor should learn and know and practice. First and the foremost, when the client comes to the counselor's job is to diffuse the strangeness. Imagine a client is coming to you or the patient is coming to you. He is coming to a new place. He has to share his deepmost thoughts, feelings, behavior with the unknown person. How is it possible? Will you be as a person can discuss your problems, your thoughts, your innermost emotions with a third person? It is simply impossible. Hence, you should know how to diffuse the strangeness. So, the counselor should greet the patient first, introduce yourself, introduce if by chance there are other people in the room, like suppose there is a technician, or else if there is a master therapist or a counselor, or if there is a trainee, you have to introduce them also. Get the demographic details. Ask the person's name, family name, and also ask about the father name, mother's name, and what is his occupation, what is his age. And after that, you can start with the opening sentence, how can I help you? At the same time, once he gives a little information about his problem, then you say, you need to educate the nature of counseling. What type of counseling you are going to offer? What are the terms and conditions? What time you are going to meet them? How you are going to meet them? Also, what are the remuneration if it is paid? So those are the things you have to discuss so that the strangeness starts decreasing and the client becomes comfortable with you. At the same time, you also need to discuss about confidentiality and also limitation of confidentiality, that whatever the information shared will be confidential unless if there is a law is broken. If there is a illegal activity has happened, I've been bound by law to inform the legal authority. Unless if there is no law is broken, definitely it will be confidential. That needs to be told. And also, you have to clearly convey them that this therapy sessions, I am not going to judge you. I am here to help you. I am here to understand and see how best we can help you and also learn skills so that you will be able to deal your life problems. And also, you can also say when we are discussing, you are free to refuse uncomfortable questions. You don't want to answer, you can refrain by that. By refraining, the therapeutic alliance will not be broken. At the same time, you have to informally take consent. Yes, is it okay with you to discuss about your problems? This is how the diffusing the strangeness is very essential during counseling sessions. At the same time, normalization of the situation also has to be done. First, you will learn how to diffuse the situation. Normalization of the situation has to be done. For example, if a client is in a distress situation, that he has lost the job and he is drinking alcohol, that time you have to say, I often see in my clinic that many people in a stressful situation, the way you are in, when they have lost the job, I have seen them, they started drinking and they have increased the consumption of alcohol and drugs. And recently, I've seen because of lockdown, and when they came out, they drank alcohol too much, 3 to 4 quarters. And I've seen very often this. The patient may feel that, okay, I'm not alone. The therapist has seen so many cases like me. In that situation, he will be feeling that, okay, this is normal. I am ready to discuss. I am not alienated. I will not be labeled. I will not be discriminated. And he will not feel embarrassed to discuss his situation or problem. In certain situation, you may also say that in a work pressure, some people will have anxiety attacks. Suppose they have to do presentation. I have found many of my clients find it difficult to do any presentation. So those kind of normalization, if you tell, they will be able to share their experiences. But please keep in mind, never ever normalize an illegal activity. Don't say, yes, it was good that you have taken the law into your hand and beaten him up. Never do that. Don't normalize illegal activity. Now moving towards the skills. Whenever you do counseling, active listening is a very important tool. Active listening is by both verbal and non-verbal. Verbal is by saying, yes, very good. What happened next? So those kinds of word rephrasing or repeating the sentence, can you clarify more about the incident happened? Those kind of things, when you say, it is called as active listening verbally. Non-verbal is making eye contact and head nodding and having the facial expression similar to the patient. For example, patient is sad, you may also have to look sad to some extent. When the patient is feeling tearful, you should not laugh and smile. So appropriate facial gesture is very important. At the same time, with active listening, ask open-ended question. Open-ended questions are those where the patient has been given a stimuli and he can respond in whatever way he can respond. It's not answering by yes or no. The best example is, I can ask a client, what brings you here? How can I help you? Those kinds of open-ended questions will definitely give a lot of information and also scope for expressing him emotions also. Can you please tell me about your family? It's an open-ended question. Can you talk about your occupation? What kind of job you are doing? So those are all open-ended questions. Maintaining eye contact, you show the genuine care for the person with mental illness or the person who has come for counseling. Do not be judgmental. Whenever the patient talks about something and he has done a mistake, never say, how can you do that? Never do that. Don't make disgusting face or make gestures. No, I would have not done that. Never do that. Because if you become judgmental, the patient or the person with mental illness or the client will stop sharing his thoughts, his emotions, his behavior. Hence, being non-judgmental is very essential part of counseling skills. At the same time, you should learn about empathizing skills. There are two important parts of empathizing skills, verbal skills and non-verbal skills. I will come to this shortly. At the same time, you have to reassure the patient, provide hope and support to the person when he is coming for counseling. Moving to empathizing skills. Empathizing skills are those skills which differentiate between interview and the interrogation. Interrogation done by the police does not have any empathizing skills. They just cull out the information. Here, empathizing skills, not only you get the information, you will understand the patient's thought process, his emotions, his behavior. So all the three domains, at the same time, the person who is sharing his problems will also feel that this therapist or a counselor is making efforts to understand my thoughts, emotions, and also behavior. So once he knows that the counselor is doing his effort, he will discuss the problem and also the healing process starts. Empathizing skill not only gets the information and makes the person to feel that he is understood, the healing process starts. Let's define empathy. As you see, the empathy is ability to sense others' emotion, coupled with the ability to imagine which someone else might be thinking or feeling. That means you are able to understand their emotion. Not only that, what they are thinking and feeling together also will be seen. In simple words, you can say empathy means ability to stand in someone else's shoes. That is what is empathy. There are three important types of empathy as been told in the literature. One is cognitive empathy, emotional empathy, and compassionate empathy. Cognitive empathy is just understanding the feeling. That means the patient is crying because he has lost his mother. You have just understood why he is crying. That is cognitive empathy. Emotional empathy is you start feeling for him. Oh my God, he has lost his mother. I can also feel the pain of losing mother. That feeling for the person is called as emotional empathy. The third one is compassionate empathy. Trying to help him. You have understood why he is crying. You also understood the feeling of losing the mother. And that feeling you are able to, that is generated in you, and you want to help him. That becomes compassionate empathy. That means you are moved to help him. That is called as compassionate empathy. In counselor, we require emotional empathy and also to compassionate empathy. During this providing empathy, even the counselors get affected. And this is very common when you are seeing or doing counseling during disaster situation or else trauma situation. There you may also get affected. Hence, having a trained counselor or a master therapist is very essential so that you can go and discuss. Today or 2 days back, I saw a person who had these problems and I found it very difficult to accept those thoughts or emotions. And you can discuss that. And again, here, before you discuss the confidentiality, you have to remember, take consent from the client or else you can discuss with the master therapist without disclosing the identity of the client. Coming to empathy, empathy is able to recognize, understand, share the thoughts and feelings of the client, what I said. And at the same time, not only you have understood the thoughts and feeling, and also you are able to feel it and you are trying to help him, but at the same time, you have to communicate to the client that I have understood. Not only you understood, you have to show that you have understood. That is the skill here. That means first you should understand the feeling, thoughts, and behavior, and you should feel the patient's or the client's feeling. At the same time, you are moved to help him. That the whole three process need to be communicated to the client that I am able to understand. That has to be communicated. That is called as empathizing skill. The best example is the justice is not only done, it also should to be shown to the society that justice is served also. That means you not only do justice, but it has to be shown to the society that justice is served. Then only they will have faith. Similarly, in empathy, only you have understood and you are able to feel the patient's pain and you are trying to help, you also should communicate that I have understood. That communication is empathy skills. The important attributes of empathy. Teresa Wiseman has given 4 important attributes. First is able to see the world as others see it. Invariably, each individual will see the world according to his cognitions. But here, you should also start looking from the client's perspective. That is one. Being non-judgmental. That is very essential part of counseling. Understanding of other people's feeling. You know about your feelings and you are able to understand your feelings, but you should also start understanding the client's feeling. At the same time, able to communicate that I have understood to the client is very essential. You have to say, I am also feeling sad. That communication has to go to the client. That means the client should feel the counselor not only has understood, he is able to feel my feelings. That is called as attributes of empathy. Now, let's move into the specific empathizing skills. Verbal and non-verbal empathizing skills. Verbal skills we will discuss now. In the context of patient has lost his job. When the patient has lost his or her job, now the empathy statements will start now. The patient would have said, I lost my job, I'm frustrated. I don't know what I'm going to do. Then you'll say, you have to now make an empathy statement. You must have felt terrible when you lost your job. Just now said you are frustrated. And coupled with non-verbal gesture has to be done. So that is empathy statement. Oh, you are frustrated when you lost the job. That you have to give that empathy statement. Paraphrasing. One is empathy statement. Paraphrasing. That is using the patient words as a cue. From there you will start and continue. Oh, you said that you lost job and feel frustrated. Can you tell me more about that? That gives a scope for what is that? Exploring and know what the thoughts and the emotions he felt when he lost the job. That is very essential. Paraphrasing. So empathy statement and paraphrasing is very essential to communicate that I'm trying to understand your not only the situation but also your emotions. Sometimes the patient may not give you the information on the emotions. The patient may say, in August I lost the job and I started looking for the job. He may be very non-emotional. You may have to ask, how did you feel when you lost the job? Can you explain what happened, how it happened? How did you cope with that? That kind of question you ask, that means you are inquiring about the emotions. It is very essential in empathizing skills. Sometimes the patient may show that I lost my job. What can I do? If that's the question, if he has made, then you should say, you sound distressed when you said that. Can you explain more about it? That will give again, you are probing into their emotional part of their life. There, the reflective skills is very essential. Means counselors reflect the client's affective statement from either verbal or non-verbal cues by various techniques. That means the patient is showing you certain emotions, either by words or by gestures. So you have to understand what kind of emotion is showing by verbal or non-verbal, and you have to reflect that. Listening for the feelings. If the patient is talking in sentence and he may word certain things. I got disturbed. I was very sad. I was very happy. So listening for the feelings words is very essential. Sometimes emotionally loaded words. It was very, very, very bad situation. If he says that emotionally word, like sometimes he may use adjectives. So those words you have to pick up on that and ask for, can you clarify? Why did you say very, very bad situation? What was the situation you are going through? Sometimes emotional tone of the speech. If the patient is talking about that he has lost his job and he could not pay for his child's school fees, and his voice starts breaking. He's about to cry. That time, you have to pick up that emotional tone. You seem distressed when you spoke about that. That should be the way you have to pick it up. Sometimes you have to pick it up from the facial expression and body gestures, whether the patient is in the right frame of mind or he is about to express emotions. Moving to the reflective skills, it's very essential. Wait for the opportunity. Either by verbal or non-verbal, he is communicating that he is emotionally distressed at that point, what he is talking about historically. Validating the emotion. Anybody in your situation, when you lost the job and when you are unable to pay your child's school fees, would be definitely distressed. What kind of father I am? What kind of guardian I am? That kind of reflective skills you have to, and also validate their emotion. That doesn't mean that you are not the only person who are feeling sad. Any person in your situation definitely will feel sad and frustrated. They may question themselves, their ability. That validating is very essential. That means he's not alone. There are many people may go through this situation. Coming to the verbal communication for empathy. Empathy can be explored in depth by open-ended question. First and the foremost, like open-ended questions like, how can I help you? Tell me more about it. Please explain. How does this problem make you feel? What makes this problem so difficult to deal? What positive changes would you like to see happen in near future in your life? In general, how would you describe your mood? How would you describe your life? How would you describe your job? Can you explain about your married life? So these kinds of open-ended statements or questions will give you an important clue about the patient's thought process and also emotional process. As much as possible, avoid closed-ended questions. Like, did you get good sleep at last night? Did you get irritable? Had breakfast? How are you? Did you fight with your parents? Do you feel depressed? Do you feel anxious? Do you hear voices? Do you feel fearful? So these are closed-ended questions as much as possible to be avoided. But however, use closed ended questions along with open-ended questions. That is called as blended questions. Start with the closed questions and followed by open-ended question. For example, look at there. Do you feel sad? If the patient says yes, tell me more about it. So that's the word. That means you started in a particular direction with the closed end, and then you started an open-ended question. This should be used very tactfully and very carefully. So blended question to be done when the patient doesn't speak. Don't go only for closed-ended question. Every closed-ended question should be preceded with an open-ended question so that you get more information about the patient what is speaking. Coming to the non-verbal part, non-verbal communication of empathy. The way you dress, the way you greet, the way you offer the chair, the way you make eye contact, appropriate facial expression, head nodding, leaning forward slight when the patient talks about his difficulties, hand and shoulder gestures, being open. So those are very essential. You should not close your hands. Making very stupid gestures during the counseling should be avoided. Body posture, the way you sit in your chair, how do you use your space when you are communicating with the patient? Making your notes during the interview. If you are making notes, please tell the patient or the client, I would like to make notes because I forget. You're talking about a lot of life events. So I would like to make and analyze later. So you have to take permission so that the patient understands that you are making notes to help him. Taking phone calls during the interview, as much as to be avoided. If you are going to take, please do take permission from the patient. Tone and tempo of speech is very essential. The way you speak, the way your voice is conveyed, the way your tempo is spoken, these are all very essential part of non-verbal skills in empathy. Please do remember, it is not what you have said. How you have said makes a lot of difference. So that is the reason tone and tempo of speech is very essential. Your reaction to the patient's history, his feelings, his behavior. How did you react when the patient says, I cried in front of females? And how can you cry in front of females? If you make such statements, the patient will shut down his thinking process and he will not communicate with you. Give undivided attention. Again, I am bringing non-judgmental posture and non-judgmental attitude will help a long way in healing process of the persons with mental illness or the client. And one important thing I should remember and tell you, that is silence. Allowing silence during the emotional response is very essential. Many a time, patient is about to break down and he will become silent. He's trying to gather himself to communicate further. Allowing silence, you also be comfortable with the patient's silence. Don't become jittered. Allow time. There may be 1 or 2 minutes, there is a silence between the therapist and the client during the counseling process. Allow that silence to happen. Even a silence is a way of communicating that I am feeling distress, I am unable to talk to you. I am going through emotional turmoil. Or else you can ask, can you tell me what is happening in your mind? Can you tell why you are becoming silent? Is there, you are feeling crying? Learn to be comfortable with the silence. Don't use this word, stop crying, stop expressing emotion, be a man. Don't use those words. Counseling is a process in which the person ventilates the pent-up emotions in him. You need to allow them to be expressed so that he starts thinking properly. In simple way, I can say you is in biologically, amygdala had a lot of emotional hijacking has occurred. So prefrontal cortex is not thinking at all. Executive function is not working because amygdala is firing in the brain. In such a scenario, when the person talks about his emotion, the amygdala starts firing less. The prefrontal cortex starts working and the person's thinking process becomes better. Hence, silence is a way of communication. Allowing silence between the client and the therapist is very essential sometimes. To come to the important part, skills decoded for learning empathy, learn active listening, understanding all domains, that is thinking, feeling, behavior. At the same time, you have to communicate. I have understood all those things with the client. Once the client knows that this counselor has understood about my thinking, about my feeling, about my behavior, the healing process starts happening. To conclude, my dear friends, the counseling skills, listening skill is very important, empathizing skills, and counseling is not providing solution, enabling the client to solve his own problem, able to make decision on his own, assertive training, communication skills, study skills, interpersonal skills. Here in counseling, you are going to teach them those skills. At some time, you may have to provide informations, authentic information, helping them to find information by themselves, and also giving certain techniques of relaxation like yoga, meditation, spirituality will help in counseling. At the same time, you remember to know how to do ethical counseling. Don't become unethical. Don't use clients for your personal purposes. So this is what is counseling skills. And to summarize, my dear friends, look at the chart. The counseling skills as starting from attending, being silent, having rapport building, immediacy, immediately what are the required, focusing, questioning, and summarizing. For empathy, rephrasing, reflecting, paraphrasing are very essential skills. By doing this, you are communicating the patient that I am trying to understand your emotion, and at the same time with your gesture and body language, you can communicate that I have understood your feeling also. So these are the essential counseling skills you should know and learn. And finally, my dear friends, counseling means empowering the client, not disabling them, enabling the client so that once they go through the counseling, tomorrow they are equipped with their skills to deal with their life problems and emotional problems. Thank you very much for giving your valuable time. Stay safe.